Ever wondered how medication transforms the lives of those living with sickle cell disease? Well, you're in the right place. Welcome back to the Victory Education Lounge. I'm your host Maurice, and today we're diving into a topic that's at the heart of sickle cell management. Medication Nation Drug Therapies for Sickle Cell, Part 23. Before we explore this crucial aspect of sickle cell care, please take a moment to like this video, subscribe to our channel, and share your thoughts or experiences in the comments below. Your engagement helps us reach more people seeking information about sickle cell treatments. In the world of sickle cell disease, medications play a pivotal role in managing symptoms, preventing complications, and improving quality of life. Today, we'll explore the landscape of drug therapies available for sickle cell patients, from tried-and-true treatments to cutting-edge medications. Remember, while these drugs offer hope and relief, they're just one part of a comprehensive care plan. From pain management and disease-modifying therapies to preventive medications and supportive treatments, there's a whole array of drugs that work in synergy to keep sickle cell disease in check. And let's not forget the emerging treatments, the promising new warriors in this battle, currently being tested in clinical trials. So brace yourselves as we delve into the fascinating world of sickle cell drug therapies. In the battle against sickle cell, a variety of medications serve as our weapons. These drugs, each with their unique mechanisms of action, target different aspects of the disease, aiming to alleviate symptoms, prevent complications, and enhance the overall quality of life of those living with sickle cell. We can categorize these medications into 5 key groups. First, we have pain management medications. These are prescribed to handle both acute and chronic pain episodes, which are common in sickle cell disease. They bring immediate relief to patients during painful crises. Second, we find disease-modifying therapies. These drugs go beyond symptom control and target the underlying mechanisms of the disease itself, aiming to modify its course and reduce the severity of symptoms. Our third category comprises preventive medications. These are used to reduce the risk of various complications associated with sickle cell disease, such as infections, stroke, and acute chest syndrome. Next, we have supportive therapies. These are medications that address the secondary effects of sickle cell disease, such as iron overload from frequent blood transfusions and the nutritional deficiencies that can occur. Finally, our fifth category is emerging treatments. These represent the cutting edge of sickle cell therapy, including new and experimental drugs that are currently showing promise in clinical trials. These categories provide the framework within which we understand the diverse medicinal approaches to managing sickle cell. They offer us a lens to view the expansive landscape of drug therapies, providing a sense of the breadth and depth of options available to patients and healthcare providers. Remember, while medications are a crucial part of managing sickle cell disease, they are used as part of a comprehensive care plan, often alongside lifestyle modifications and supportive therapies. Now that we've outlined the categories, let's look at some specific examples. From tried-and-true treatments to cutting-edge drugs, let's explore some key players in sickle cell therapy. First up, we have Hydroxyurea, also known by its brand names Hydrea and Droxia. This medication has the distinction of being the first approved by the FDA specifically for sickle cell disease. It works by increasing the production of fetal hemoglobin, which in turn reduces the frequency of painful crises experienced by patients. Next, we have L-glutamine, which you might know as Endari. This oral powder works by reducing oxidative stress in red blood cells, which helps to decrease the risk of pain crises. Our third medication is Voxelotor, or Oxbryta. This is a newer drug that works by increasing hemoglobin's affinity for oxygen, which reduces the sickling of red blood cells. Fourth on our list is Crizanlizumab, also known as Adakveo. This medication is a monoclonal antibody that helps prevent blood cells from sticking to the walls of blood vessels, reducing the instances of pain crises. Last, but certainly not least, we have penicillin. While not specifically for sickle cell disease, prophylactic penicillin plays a crucial role in preventing life-threatening infections in young children with sickle cell disease. Each of these medications brings a unique approach to sickle cell management. They represent a diverse range of strategies, from increasing fetal hemoglobin production to reducing oxidative stress and preventing blood cells from sticking to blood vessel walls. These drugs, along with others, are part of a comprehensive care plan aimed at managing symptoms, preventing complications, and improving the quality of life for those living with sickle cell disease. Every medication has its pros and cons. Let's weigh them for our sickle cell therapies. Starting with hydroxyurea therapy, the pros include reducing pain crises and hospitalizations, thereby improving overall health. However, the cons are that it requires regular blood tests and may cause side effects like low blood counts. Next, we have novel therapies like Voxelotor and Crizanlizumab. The pros are that they target specific aspects of sickle cell pathology and may be more effective for some patients. The cons, however, are that they are relatively new, so the long-term effects are still being studied and they can be very expensive. Pain management medications, on the other hand, provide relief during acute crises and improve quality of life, which are the pros. The cons are the risk of dependence with opioids and potential side effects. Preventive antibiotics dramatically reduce the risk of severe infections in children, which is a significant pro. The cons are that long-term use may lead to antibiotic resistance, and it requires consistent adherence. Lastly, we have combination therapies. The pros are that they may provide more comprehensive disease management. However, the increased risk of drug interactions and the complexity of managing them are the cons. It's important to remember that every individual is unique, and what works best for one person may not work as well for another. Therefore, a personalized treatment plan, created in consultation with a healthcare professional, is crucial. This plan would take into consideration the patient's specific symptoms, overall health, lifestyle, and personal preferences. Balancing the pros and cons of each medication is an essential part of this process. It's about finding the most effective treatment with the fewest side effects, and one that aligns with the individual's lifestyle and personal preferences. These considerations highlight the need for personalized treatment strategies. Medication doesn't just manage sickle cell disease, it also plays a crucial role in prevention. To start, let's discuss folic acid supplementation. It's a vital part of managing sickle cell disease because it supports the production of red blood cells. Since people with sickle cell disease have a higher turnover of red blood cells, they need more folic acid than the average person. By taking a daily folic acid supplement, they can help their bodies create more healthy red blood cells, reducing the risk of anemia and other complications. Next, we have iron chelation therapy. This is a treatment used to prevent iron overload in patients who receive frequent blood transfusions. When too much iron builds up in the body, it can damage vital organs like the heart and liver. Iron chelation therapy uses medications to bind to the excess iron, allowing the body to safely remove it. This therapy can be a lifesaver for patients with severe sickle cell disease who need regular transfusions. However, it's important to remember that while these preventive strategies can make a significant difference, they're not a cure. They're part of a comprehensive care plan that includes other medications, lifestyle changes, and regular checkups with healthcare professionals. Moreover, these prevention strategies aren't without their challenges. Folic acid supplementation is generally safe, but it requires consistent adherence to be effective. Iron chelation therapy, on the other hand, can have side effects and needs to be carefully monitored by a healthcare provider. But despite these challenges, the potential benefits of these prevention strategies can far outweigh the risks. By supporting red blood cell production and preventing iron overload, they can help manage symptoms, reduce the risk of complications, and improve the quality of life for people with sickle cell disease. Through both management and prevention, medication is a cornerstone of sickle cell care. That wraps up our exploration of Medication Nation, Drug Therapies for Sickle Cell, Part 23. We've journeyed through the landscape of drug therapies, breaking down the key categories and examples of medications used in sickle cell treatment. We've delved into the pros and cons of these therapies and discussed the role of medication in prevention strategies. Remember, while these drugs offer hope and relief, they're just one part of a comprehensive care plan. With new treatments constantly emerging, it's an exciting time in the world of sickle cell management. Before we wrap up, here's a quick disclaimer. The information provided in this video is for educational and entertainment purposes only. It is not intended as medical advice. Any health-related decision should be discussed with a licensed physician or qualified healthcare professional, especially if you have existing health conditions or are taking medications. Thank you for joining us in the Victory Education Lounge for this exploration of sickle cell medications. Don't forget to like, subscribe, and share your thoughts below. Your engagement helps us create more content that educates and empowers the sickle cell community. Until next time, this is Maurice reminding you that knowledge about your medications is power in managing sickle cell disease.